Okay, so I'm Dr. Lindner, and we're going to be looking at the Circle of Willis, blood supply to the brain. So let's look here first, where we can see the cervical spine, and you see the transverse processes, and you could see an artery going through C1 to C6 transverse processes through the transverse foramen. That would be the vertebral artery. Here, in front of it, this would be the left common carotid. Anything with common is usually going to separate into an internal and external something. So this is the common carotid, and it will divide into an external carotid and an internal carotid. Now, if we follow the vertebral artery, and we follow the vertebral artery, we see it going through the magnum foramen, right? See it going through the magnum foramen. So now we're on the inside. Here's the magnum foramen. This is your left vertebral artery and your right vertebral artery. They converge to form the basilar artery. Now we see the circle right here. This is called the Circle of Willis. So this portion, this artery, and this artery are all cerebral arteries. This going to the anterior cerebrum, this going to the middle cerebrum, and this going to the posterior cerebrum. So this is the posterior cerebral artery, middle cerebral artery, and anterior cerebral artery. So now we have three arteries left. Where's the internal carotid? Where's the anterior and posterior communicating arteries? So if we follow this internal carotid, and we follow it up through the skull, it's going to take us. I'll move this out. Here it is. It's coming up right to here. So right here is going to be where the internal carotid comes in. Here and on the other side as well, right here. So in front of it and anterior to it, this is the anterior communicating artery, and posterior to it, here, and here is the posterior communicating artery. Okay? And you could see all the other cranial nerves that are pretty close to it. That's your trigeminal. Remember, the trigeminal has three branches, going to the ophthalmic, to the eye, going to the maxilla, to the upper jaw, and going to the mandible, to the lower jaw. So you can see why when there are blood vessel issues, if they get dilated, they can actually press upon the trigeminal nerve, giving people bad migraine headaches to the eyes. Okay, so hopefully that covers it. So just to review, make sure you know your internal carotid, your external carotid, your vertebral artery. You should know the basilar artery. You should also know the posterior communicating artery, anterior communicating artery, and then anterior, middle, and posterior cerebral arteries. Okay? Hopefully you enjoyed that short, brief video.